Okay, everyone. Good morning, good afternoon, good evening, wherever in the world you are. My name is Florencia Guerzovich. I'm talking to you all from Florianopolis in Brazil. I'm a consultant and a researcher, and one of my hats is that I'm a senior advisor to a World Bank Trust Fund, the Global Partnership for Social Accountability. GPSA, as we call it, provides grants and non-financial support to civil society-led interventions that implement what we call collaborative social accountability. I'm going to share my screen so that you see maybe the theory of action of the program as I speak. Um, And it's GPSA is also a broader partnership. And monitoring and evaluation and learning of what not just GPSA partners do, but what other groups do and think about the broader field of social accountability. In terms of the evidence conversation, we've been leading a conversation about how to do MERL that it's useful for decision making of complex interventions, mixed results, alternative pathways to scale, and understanding what context looks like in practice and how it should inform our interventions. Our panel today will be very busy and touch on a number of projects that a team in BRAC University in Bangladesh has been carrying out. We will hear from Dr. Mirza Hassan. You can see the bio in the screen. He will talk about the partnership between BRAC and the Campbell Collaborative. Then we'll have Iffat Zahan, who will present work on an evidence gap map that they've been putting together in the last few months. And then Shamael Ahmed will take on social accountability to talk about a new project at BEC in collaboration with others. So first, I'm hoping that I can stop sharing now. We're back. Let me share a few words on the discussion on evidence in the social accountability space to frame the conversation. So when I BRAC was doing this with the Campbell Collaborative, I was very pleased to hear that a Southern organization was leading on such exercise. We've had a Northern skew for too long. And even when we have partnerships, those partnerships are often quite unbalanced on a number of dimensions. So I think this is a great point, great sort of like effort to try to shift how we think, who thinks, whose voice gets heard, and how. But I also told I think we told the BRAC team that they were getting into a very, very complex task, trying to get an evidence gap map of social accountability together. It's much more complex than the protocol gap maps or other synthesis, other types of synthesis would suggest. Social accountability is a very contested term. It has a very dynamic practice. So the theory often on which, and the research on which this protocol suggests we should build on lags behind the practice. So first problem. Second problem that we have, and it may seem paradoxically given what I said, is that the term is, at least in my view and the view of others, conceptually stretched by practitioners. It's useful to put the label to things that are not social accountability, marketing, for fundraising, for a number of other tasks, which make the evidence mapping a little bit complicated sometimes what's labeled under social accountability, it's hard to recognize as social accountability. So in addition to that, what counts as evidence? It's also highly contested in the social accountability space. We've had, like in other spaces, this traditional debate between qualitative, quantitative, RCT, that has been very loud and sometimes very unhelpful because it hides other methods. And the key question is, which is like, when should we be using each method rather than like this always A or always B, right, approach. There's also the issue that what does the claim to evidence actually say? So can we back up reasonably with evidence what the thought leaders and theories of the field look like? And my colleague Tom Aston did recently a piece on like the evidence on sanctions for social accountability. He found is that no, we cannot claim, like we're over claiming in theory sometimes things that we cannot back up in evidence, and that's a challenge that we have in the field. And also, who gets cited, right? Counted, whose research counts in the process, whose tacit learning counts in the process. It's also determined, I would say, more by the politics of evidence than by the quality of the evidence, right? And that's another problem we're dealing with because we have some great evaluations, right, and great synthesis of evidence that no one cites. And one has to scratch the head as to what's going on here. So continuing the complicated, these are complex interventions. Often only a part of them gets evaluated rather than the interaction effects across the different components or the whole interventions. The risk also that non-interventions get counted as interventions. That's also an issue that we need to deal with and that the BRAC team has been dealing with. As Massett and White have called, this is a world of mixed results where context matters. So it's a world of transferability rather than generalizability. But a lot of our theories, especially given the very strong normative grounding in universal principles, don't have an easy time with transferability, right? It's either all it's the same and universal or all it's different and localized. And that's not what the evidence says. So we have that challenge. So, I mean, in short, what I want to say is like, while this exercise of the BRAC will seem neutral and technical, it's a lot about the positionality of the team carrying it out. And where the BRAC team stands, right, will highly influence the product, who will find it useful, who will not find it useful, right? Within the broader discussion of social accountability. And in that sense, you know, where the GPSA stands is it's probably different in a number of issues. The positionality is different, but we still value the fact that something's tried in a sense, and that there is like there's an. So with that in mind, I invite you all to listen to Mirza. But before that, I want to flag there is like, if you look at your screen, in the right side, there is a Q&A button. As the presentations go, you can click on that button and ask your questions. We'll pick all of them up at the end as time allows. So Mirza, over to you.
Okay. Thank you very much, Florencia. I'm going to present now, and Ali is a PowerPoint, and Iffat is going to help me with that. And this is it. Can you make it a little bigger? Is it possible? Okay, let's move on. So this is about, the introduction was given by Florencia, the conceptual idea behind it, and all the problematics and so on, and also the definitional problems of social accountability. The highly contested, theoreticians of different kinds of position look at it in a different way, define it in a different way. Practitioners have their own take on it. So that's there. For that reason, we have come up with a kind of standard definition with a bit of minimalist definition, so that can guide our review of literature that we have done, which will be explained later. So essentially, the theme was we are looking for the effectiveness of social accountability interventions in low and middle income countries. And this is an evidence and gap map. We call it EGM from now on. I'm going to term it as EGM. The next slide, please. One of the reasons that we wanted to do this was that we wanted to develop our capacity. It's a bit technical exercise, and we wanted to do it so we could build this capacity to how to do this kind of evidence synthesis, so we can support development policies for the public authorities. That was one of our motivation to partner with the Campbell collaboration. They are the expert in this area with rich experiences and so on. The project that we got involved is called Effectiveness of Social Accountability Intervention in Low and Middle Income Countries, and Evidence Gap Map. I mean, the title is self-explanatory. And that was the aim, looking at the social accountability's effectiveness. But and I'm going to define a bit more what we mean by this effectiveness. As I said earlier, the objective has been building an evidence base in relation to social accountability intervention in low and middle income countries and so on. So it is more accessible to the policymaker, to the researchers, to the development practitioners, not only to do it, but also to make it accessible. So these three categories of actors can access it and use it for both for conceptual purposes and also for development practices. Next one, please. Okay, so about the context. Social accountability, one kind of accountability. There are other forms of accountability, direct, horizontal, and so on. But social accountability essentially means that it's a tool that citizens can use to exact accountability of the authority, be it a service provider, be it any other function, developmental function. And then it is a direct civic engagement, not indirect. So citizens, both in organized and unorganized form, can do it. They can do it directly, or they can be nurtured, helped by NGOs, CBOs, and the other way of doing social accountability will be the media. Citizens can directly use media. The people can also use social accountability directly to exact accountability from the authority, from the public authority. And it is initiated and supported by the state, citizens, or in most cases by both. And it is mostly based on invited space. Okay, so invited space means here that it is agreed upon by the state or any other public authority. Okay, fine, we'll where citizens can come in and conduct the process of social accountability. So it is invited space in that sense. There could be a claim space where, say, social movement, spontaneous social movement, protest movement can do the same, exacting accountability, and that would be social accountability. And perhaps it is the numbers and the frequency of this kind of claim space is very, very low. And in our Iffat is going to talk about that. I mean, the majority of the literature, the intervention that you've looked at, they're overwhelming about invited space, hardly any claim space. So that's the reality. Next one, please. Okay, so what is the importance of social accountability? Why do you need to do that? It obviously improves transparency. It ensures responsiveness and answerability of the public authorities. And doing this, it has the impact of reducing corruption. And it also and it enhances the sense of ownership of the community. Both unorganized citizens, organized groups of citizens, and so on. So that's another very important implications of social accountability. More narrowly, it is appropriate. It helps the budget allocation to be appropriate and inclusive. So when through social accountability, like open budget meetings at the local level, when citizens can provide input or review the process, the budget can be made more inclusive and also doing things in the right places, in the right directions. So the fund flow go to the appropriate places as felt need of the local community. And it also ensures efficient delivery of the services in terms of timeliness, cost effectiveness, and so on, because of the constant monitoring by the social accountability mechanisms. Next, please. Okay, and I'm going to talk about the framework of social accountability, EGM, that we have conducted. So in this, yeah, go ahead. In this framework, there are two sets of things. One, we looked at the different interventions that we have looked at. That includes access to information, citizens' voice and representation, governance, mobilization action, resource monitoring action, and so on. So these are the kind of interventions that we've looked in the literature to find out what kind of studies have been done in this area, varieties of studies that Iffat is going to elaborate later on. And the outcome that you have looked at are the performance improvement of public and private actors and institutions. We looked at the service quality. We looked at the allocative efficiency, particularly in terms of budget and other kinds of planning, development planning. Efficient citizen engagement, that was an expected outcome that we have looked at. Of course, inclusion, responsiveness of the public authority. So those interventions that we talked about led to this kind of outcome. Quality of life in terms of health, education, empowerment, and well-being. Knowledge and learning outcomes. This is the lessons learned from this, from the interventions by the different studies that we have looked at. And that helped in terms of refining, modifying those kind of interventions as a feedback mechanism, and to ensure sustainability and to also to make it feasible for scaling up. So these are the outcomes that we've looked at. Next one, please. And why did we do it, AGM? To find out the question, do social accountability interventions work? Looking at the efficacy of social accountability intervention. And to get that answers, of course, we need robust evidence base. And that was one of the major purpose of this exercise of the EGM. And the existing literature that we have found, I mean, the limitations of the existing literature, that is largely theoretical, very few impact evaluation experimental studies. And when Iffat presents the rest of the slides, she will talk about that. And the literature is very scattered and difficult to locate. And this EGM will also help us in terms of advancing umbrella guide to policymakers and academicians to overcome the limitations that I've just mentioned, and to provide some kind of guidance for both policymakers and also the academicians. Next one, please.
Mirza, we're on time, more or
Yes,
less?
yes.
Okay.
Okay. Iffat, do you want to take over?
You can finish and however you guys want to transition. I know it's a team.
This is the last slide. This is your last slide.
Okay, so also social accountability EGM can help users to identify the size and the quality of evidence base of social accountability intervention, and show users where there is no evidence, the evidence gap, and identify those gaps we filled by new evidence for researchers and research commissioners, thus providing more strategic policy-oriented approach to research agencies. So these are the rationale for doing it. Okay, so since we have paucity of time, Iffat, can you go ahead with the rest of the slides? Those are the most important slides, actually.
Okay, thank you, Mirza bhai. Can you hear me, Florencia?
Perfect.
Okay. So Dr. Mirza discussed and why we have chosen this topic to build our EGM on. Before going into the details of this particular EGM, I want to discuss the objective of this EGM. If we formulated these particular research questions: what is the size and quality of the evidence base of social accountability interventions in low and middle income countries? Where are the gaps in the evidence that can be filled in with new studies and interventions? We want to reach these objectives by building an evidence and gap map. I will quickly show you how an evidence gap and map looks like. Is basically as evidence synthesis product that visualizes the available evidence related to particular research questions. It usually is broader than the reviews in terms of scope. Systematic reviews in most cases work with fewer interventions, while map gives the opportunity to encompass more. The map does look like a vertical will show you the intervention categories, while the output will be shown in the horizontal first two rows. If you click on the bubble, you can see the under each interventions and outcome. The studies can be further filtered by region, country, study design, and population at the upper portion of the map. Please note that this is not the screenshot of our EGM. Our EGM is still in the process. This is an existing EGM. Now I will move on to the discussion about how we are developing the discussed EGM on social accountability. In the very first stage, we developed a framework in consultation with Campbell, which consists of the intervention and the main categories for the interventions have already been presented by Dr. Mirza. We will show the subcategories in the analysis part. We kept the scope of the map broader as it is a synthesis map, and we want to cover the whole evidence base of social accountability. Next stage was to develop an eligibility criteria, as in what kind of studies we will be eligible for our map. These are the criteria we followed while including the studies. We included primary and systematic reviews and only quantitative studies, that are experimental studies, pre-post outcome measurement, non-experimental design, with or without comparison group. All the studies were included which are conducted after the year 2000. Studies that are focusing on LMICs, either completed or ongoing, and both journal article and grey literature are included. Studies which are not in English were excluded. Next stage was to develop a concrete search strategy with possible search strings. The researcher developed that in consultation with Campbell information specialist. We searched 17 database, 20 websites following that particular search strategy. The details of the search strategy along with search strings for each database can be found in our report, which will be published soon. Following this strategic search, we ended up with 5,267 studies. Then we found 374 duplicates, which were dropped. Screening through title and abstract reading, we included 1,225 studies. After that, in the next stage, the researchers read the full studies and screened the studies based on our inclusion criteria that I already mentioned before. At the end of full text screening, we included 53 studies. As you can see, most studies were excluded based on the study design, 704 4 studies. As mentioned by Dr. Mirza, that the literature of social accountability is very theoretical. We ended up getting 44 impact evaluations and 9 systematic reviews. We extracted data from these 53 studies in the next stage. As we discussed before, that 17% of all studies were systematic reviews. Systematic reviews were assessed through a checklist, which is called AMSTER checklist. We measured the quality through that checklist and saw that 33% of systematic reviews are of high quality, while 67% of them are in moderate quality. Based on the data, we can see that there is already a gap region-wise. Lower middle income countries have most evidence, while upper middle income countries have the least. So here we already see that the size of the evidence is bigger in lower middle income countries. Population-wise, most studies focus on the rural sectors, around 51% studies. Only 19% studies focused on the urban sectors. Subpopulation-wise, very few studies focused on the indigenous people, people with mental illness, people with disability, and elderly. 89% studies focused on overall adults and youths. 1/4 of the studies focused on the women. So any researchers or policymakers can see that we need to focus, which populations we need to focus on. Now we look at what kind of intervention most studies covered. 57% evidences are about social audit, citizen feedback, citizen report cards, and community scorecard. These are the subcategories under the categories Dr. Mirza has mentioned. Then 42% studies are about capacity building of civil society groups, organizations, and CBOs. As we can look below the graph, we see that very fewer studies focused on the public expenditure tracking surveys, participatory budget analysis, and social mobilization campaigns. So this is again very clear for any policymaker, researchers, that the gaps here and gap is here, and they can focus on the least studied intervention like participatory budget analysis or social mobilization campaigns. Those studies reported to have some outcomes. Most studies reported that the outcomes are related to service delivery. 51% reported to have efficiency of service delivery, while 40% reported to achieve increased service utilizations. Most study could not achieve the outcomes like targeting efficiency in program design, meeting and forums, budget utilization, budget formation, and answerability. Only 2% of studies reported all of these outcomes that they achieved. So based on this analysis, we can see some gaps where policymakers or researchers can focus on. The purpose of this EGM is to visualize and categorize the existence of an evidence base so that the conversation surrounding what exists and what is further needed can be easier for the policymakers. Despite the challenges the team encountered while developing the framework of the map, the scope of this map is large as it has encompassed almost all relevant categories. The gaps that this map has already identified can be a starting point for the discussions around what evidence is needed to be studied further and which locations are deprived of the interventions. We are yet to publish our protocol and descriptive report. Please keep an eye on BIGD's website and Campbell Collaboration's website. We already have published a blog on this social accountability EGM. Please have a look at it. Thank you for listening in, and if anyone wants to contact for further information, you can reach Mirza, Hassan, and me on these email IDs. Thank you.
But just in time, Shamael, you want to continue with your presentation?
I'll share my screen. Is my presentation visible?
Small, but screen, not the presentation. So you probably
Shamael, we
need to
can
go to share a tab rather than your screen and choose the appropriate tab.
Sorry. I'm sorry, there is a technical issue where I can't open my Google Chrome tab. Can you please give me a moment?
हेलो तुम क्यों आ रहे हो थोड़ा टेक्निकल सपोर्ट चाहिए
We have an echo.
okay so what's the problem
I think we can do it now.
Yeah, there we go.
okay
Sorry for the lag. Hello everyone, this is Shamael, and today I will be presenting our systematic review protocol on the effect of digital payments for social safety nets on take-up and transaction costs for the implementers and beneficiaries in low and middle-income countries. So this study is actually executed jointly by BIGD and Campbell Collaboration. And since this study is still ongoing, today I will be covering up mostly our background and walk you through our methodology. So to start with, by giving a brief definition of social safety net programs, as we all know, ideally it is a program through which beneficiaries receive benefits without incurring any cost. However, in practice, these programs have many hidden costs for both beneficiaries and implementers. This is mostly because these cash-based social safety net payment programs are done manually, which turns out to be quite inefficient. And this inefficiency is unfortunately more evident in developing countries due to their poor financial infrastructure, which is why currently there is a growing emphasis on digitizing the social safety net cash transfer programs. Now that we got to know about where the problem lies, let's try to understand how a systematic review on this topic is essential. Just a few minutes ago, like I mentioned, that digitizing the social safety net payments could reduce extra costs. However, this intervention of digitizing still lacks a strong evidence. It's because in terms of systematic reviews, there are currently very little literature on this, which equals to like a lack of empirical support and unstable foundation to build policies on. And since there is a lack, which is where the systematic review comes, because as we know, systematic reviews are basically studies that identifies, evaluates, and summarizes the findings of all relevant studies on certain issue, making the available evidence more accessible to decision makers. So here is why a systematic review is considered essential in this particular topic, because this will hopefully add more evidence on different experiences in digitizing social safety net payments, targeting both the beneficiary and implementer groups. And also based on our knowledge on existing reviews on digital social protection programs, this systematic review, which is our particular systematic review, will be the first of its kind to provide a compilation of both qualitative and quantitative evidence in understanding the role of digitalization in protecting financially excluded social groups. So to sum it up, our objectives are to analyze the impacts in the presence of the intervention of digital payment. First of all, to see the effect of digital payment on take-up and transaction cost paid by beneficiaries. Secondly, to understand the effect of digital payment cost. Know about the factors that have been barriers to or facilitators of successful implementation of digital payment of social safety net programs. Now, to draw all of these explanations together, we formulated our logic model as this. As discussed so far, this is the problem that we're facing, that the manual payment system of social safety net program is inefficient and time-consuming. That's why our goal is to increase the efficiency of government to pay people payment system through digitization. And the aim is to achieve it through policy innovation from the state and investment in technology capital, which could be done through by creating partnerships among government ministries, development organization, and other implementation agencies through various conferences or deliverables. Also to administration and public representative. There could be trainings for social safety net staffs, also trainings for beneficiaries through different kind of workshops and projects. And not to forget, since the new payment system is a digital system, to digitally literate the beneficiaries could be one of the activities too, through various types of awareness programs or workshops. And from these activities, the expected outputs would be the minimal use of manual cash transfers, because we expect the platforms to be more coordinated and organized, then a better maintenance of cash transfer records, and enhanced sense of ownership of the beneficiaries due to the improved privacy of their payments and better information dissemination, and a better awareness of the beneficiaries of their rights, and an increased transparency of the process, which altogether will bring us to our outcome of reducing transaction costs for the beneficiaries, as well as reducing leakages and increasing cost effectiveness of the programs. Now moving on to our methodology section. We formulated our search strategy by developing free text terms from our PCOS, and the developed search strings were verified by our information specialist from Campbell Collaboration. We plan on searching on academic databases and as well as international organization websites for great literatures. We also plan on doing hand search, because during our initial search, we identified the names of a number of specific social safety net programs, as well as mobile money platforms of different countries, which even if we incorporated into our search string, we wish to hand search these terms in few of the specific databases. Now moving on to our PCOS, our population includes social safety net beneficiaries and implementers of low and middle income countries. Our intervention includes digital payment and all the digital payment modalities listed here. Our outcome, we hope to see both primary and secondary outcomes. For among our primary outcomes, we're planning on looking into the transaction costs for beneficiaries, which will include travel time, wait time, and also briberies. We will also look into the cost effectiveness and leakages and the take-up rates by beneficiaries. And as for our secondary outcomes, we plan on looking into the barriers and facilitators of the digitalization of the programs, implementation of the programs. Here is a list down of our inclusion and exclusion criteria. We plan on including all RCT studies, quasi-experimental studies, studies that focuses on costing or cost-benefit analysis, non-experimental studies, which will be using a valid identifier strategy, and also include evaluation. The studies that we will exclude will be the ones that are not in English language, also papers that are not about digital payment intervention, and mostly studies that do not include any of the inclusion criteria. As for our data extraction plan, this is a quick glance to our screening tool, which is formulated in a flowchart following our inclusion and exclusion criteria. So for screening, we plan on having 2 reviewers who will exclude studies based on title and abstract first. And in case of any disagreement between the reviewers, it will be resolved by the authors. And if any study is felt insufficient for screening from the abstract, the full text will be retrieved. And overall, the whole process will be supervised by the review authors. Here is a quick glance to our coding tool as well. These items are mostly listed from our inclusion and exclusion criteria. For coding, we plan on 10% double quoting. And for data synthesis, we are hoping to do meta-analysis if we get ample amount of quantitative studies. So far, for our protocol, this is it. Thank you so much for your patience. And if we have any questions and suggestions, hopefully we will take it in the next session, which is the question answer session.
Thank you. So I don't see any other questions here other than whether you'll make protocols public, and there are other years of data available for longevity. I'm not sure if it's for this panel or the next. It's confusing, but I action to link my earlier comments to what you presented, Iffat. So I was very interesting that you found no gap on participatory budgeting, because I recall not only a lot of academic research on participatory budgeting, probably more than on a lot of other approaches, but also a lot of some big research, like funder-funded research on participatory budgeting. So that's where one needs to think about what the protocol sort of like restricts, in a sense, versus really, do we have an evidence gap here? And I think one could say the same about sort of like what one can question whether, and we have debated this, whether social movement is an intervention, a fundable intervention, hence should it be included in the map? And one should wonder, isn't there a massive literature on social movements, more other aspects that maybe in your research appear as less of a gap? So I think sort of like that navigation of the sort of like the, let's call it straitjacket, right, that the protocol imposes, and what a direct read of the protocol entails, like maybe like a false friend in a sense, for someone interpreting where to invest in further evidence, because those definitely, given the broad, would not look like gaps for me. I'm going to link some research here on those issues, like just to illustrate.
Sorry, is there any questions? I I can't see any question and question answers tab. Can you see any?
No, there isn't any question, Iffat.
Yeah,
There's
no, there's no
one
question.
on
That's why I
the.
made that comment. Sort of
Yeah.
like on the. So if you want to discuss that, sense, maybe take it.
Mirza bhai?
Well, I mean, you can help with the gaps that you have seen in the literature, but it's about social, whether social mobilization or protest and as such are social accountability. Of course, these are debatable issue, and but we looked at that, didn't we? If I mean, I mean, as you said, Florencia, there is a big literature out there on that, and we included, I think, the protest. Iffat, can you help me with that?
Yeah, we included social movement as an intervention in our categories framework, but we did not find any impact evaluation as of yet. While we were searching, in any studies, social movement is used as a social accountability intervention. There are a lot of literature or theoretical literature on that, but we did not find any impact evaluation on social movement.
So that kind of very strict parameter, obviously, that Florencia, that you wanted to that you were referring, that that is a bit of a constraint that didn't allow us to look into those kind of literature. I mean, some of them have even academic literature on social movements have some kind of evaluation, if you like, in the sense that there's an opinion on that, about their efficacy, about their impact, and so on. Maybe in a bit of a more in an abstract form, maybe in a diluted form, maybe in some kind of qualitative observation. But that got didn't we couldn't incorporate those, given the strict criteria that we imposed on the selection of the literature. You need to unmute, Florencia.
Right. I think the question here is like I'm thinking like with a sometimes funder or funder advisor hat, right?
Mm-hmm.
And so like to me the puzzle here is that this exercise suggests that we should be investing more in research about in impact evaluations, about an evidence. I mean, there's a limited pot of money for this whole package, right? Regardless of the method you use, there's a limited pot of money. And this research, because of the implication, the parameters it has, argues that we should be invested more on these substantive issues, And when I look at where funding investment for research evaluation and evidence has gone in the last 5 to 10 years, these are areas where there has been, like, it's paradoxical, but these are been like relatively more investment, right, on other methodologies which might be better fit for purpose, might be preferred by the donor, might be preferred by the implementing partners. There are a number of reasons why that's the choice. Might be preferred by the academics that would suggest, right, that compared to what areas that you have in your list that seem to have more, actually have more updated research on those that appear as a gap. And like participatory budgeting is a clear one. And that's the paradox I think that one needs to have, and the difference between producing evidence versus like how does one read that analysis for informing funding decisions, right? I think that's where, like, you see there's a paradox in the results. You follow this protocol, right? And this is where the protocol led. we can debate if one should or shouldn't include this type of intervention.
You chose to include them, right?
And what you come out with this protocol, it's very paradoxical in light of where funders invested in research and evidence building in the last 5 years. Because what you see as gap actually it's a gap in terms of impact evaluations, but not in the broader scheme of things.
Yes.
So I think like I want to kind of like sort of like that's my reflection, as I would say, on the exercise.
Thanks.
I don't know if anyone else has.
Yeah, there are no more questions so far, but.
Okay, so if there's no more questions, I think that it's I'm just adding a few resources here, featured by different funders, for the conversation. And I think we'll close it at this, unless you all want to have a last word, last 1 minute to close.
Hi, there is a questions.
I don't see any new questions.
Yeah.
On the, do you see where? Do you see? There's like a.
There's one question about.
Okay, take it. Oh, because we have panel and event. Sorry, we have like 2 different threads here.
I think this question is not related to our panel. I'm not sure.
Yeah, I think that makes sense. So if you all want to kind of like 1 minute closing.
Isabel?
Yes, sure. Well, this has been a great experience for, as I said at the outset, that BIGD decided to invest on this in building capacity, which we thought is a very important project. With all the limitations, and those limitations can be definitely overcome in future. But this is a very important area, and we are at BIGD, where the social accountability, citizens engagement, we take this very seriously, and this is one of the core area of research and interest, especially in the cluster that I belong to, the politics and governance cluster. And there is a great demand, increasingly great demand, even by the state, by the government, on this. And I personally think that this is a significant exercise that will give very objective assessment, understanding of the efficacy of social accounting intervention. And as I said, I mean, there are still we have there are confusion, or there are more that we need to think about. How do we broaden the scope so we can include more and bring more nuanced ideas and nuanced conception in defining social accountability, and more importantly the impact that is had on the efficacy and inclusiveness of service delivery or other kinds of intervention, developmental intervention. Thank you.
Great. So Iffat, Shamael, do you want to add anything, or should we close to here?
This is our first evidence and gap map, and we chose social accountability. And I think this is a very difficult field to work with. So the definition itself is very contested. So I think we try to cover most of the impact evaluations here, and the process is still ongoing. We are yet to develop a report. So I think given Florencia's recommendation and reflections, we will revise everything, and we will try to make it better in our final reports. Thank you.
Okay, thank you. Shamael, anything you want to add?
Nothing else from my side.
Okay, well, and we'll see how this continues. All the best for the research, the different research pieces, and for the event to the organizers. Thank you all, and have a good day or afternoon or evening, wherever you are. Bye.
Thank you. Thank you.
Bye.
Bye.
You can just leave.